Hello, Steve. I'll be your nurse today. My name is Anna. Before we get started, can I have you state your name and date of birth for me?
Steve Nichols, 6/29/82.
Thank you. Now, what are you here for today?
I'm here to get my elbow looked at. My friends keep calling me Mushroom Man, and my 3-year-old niece doesn't want to come near me because of it.
Okay. Well, I'll go and let the doctor know that, and I'm sure he'll be in here shortly. If you need anything, there's books over there for you to read, but he should be in here in a few minutes.
Thanks.
Hi again. So it looks like the doctor prescribed you to Triamcinolone Acetonide cream for your psoriasis. What it is it's a topical corticosteroid, and it's prescribed to relieve skin inflammation, itching, dryness, and redness. It can be used as a nasal inhalant for seasonal perennial rhinitis, intra-articular injections for acute gouty arthritis, bursitis, rheumatoid arthritis, and others, intralesional for discus lupus, erythematosus, keloids, lesion plaques, psoriatic plaque, and lastly, the topical ointment is for the relief of inflammation, pruritus associated with corticoid-responsive dermatosis. Its action is to inhibit accumulation of inflammation cells and inflammatory cells at inflammation sites, phagocytosis, lysosomal enzyme release, synthesis release of mediators in inflammation. It prevents and suppresses cell-mediated immune reaction, and it decreases and prevents tissue response to inflammatory process. Some things that it treats is seasonal perennial rhinitis, acute gouty arthritis, bursitis, rheumatoid arthritis, discus lupus, keloids, lesion plaque, psoriatic inflammation, and dermatitis. And what you have is the psoriatic plaque. That's what cirrhosis is. How it works is the absorption of the topical corticosteroid is determined by the integrity of the epidermal barrier and the use of occlusive dressings, which would be like any gauze or anything usually that they put over wounds. Topical corticosteroid can be absorbed from normal intact skin. Inflammation and other disease processes in the skin increase percutaneous absorption. Occlusive dressings substantially increase the percutaneous absorption of topical corticosteroids. So occlusive dressings, they may be valuable for the therapeutic treatment. Once it's absorbed in the skin, the corticosteroids are handled through pharmacokinetic pathways similar to systemically administered corticosteroids, and they're bound. How they work is they bind to plasma proteins in varying degrees. They metabolize primarily in the liver and then are excreted by the kidneys. Some of the topical corticosteroids and their metabolisms are also excreted into the bile. Bless you.
Thank you.
Now, there are many ways it should be taken. You can do it by an intramuscular injection, which would be 60 milligrams intradermal, which is a 1 milligram injection. Intra-articular, which is what you're going to be doing. That's where you put 2.5 to 4 milligrams of the topical corticosteroid on the infected, or not really infected, but the part of your body that the disease is on. It's generally applied to the affected area as a thin film from 2 to 3 times a day, depending on the severity of the condition. Yours is going to be about 2 times a day. We'll start off and see how that works. And if it doesn't work very well, then we'll bring it up to 3 times a day and see how that works. Again, with the dressings, it may be used for the management of the cirrhosis or the condition. If an infection develops, the use of occlusive dressings should be discontinued and appropriate antimicrobial therapy instituted. If you miss a dose, apply the missed dose as soon as you remember. But we don't want you to double up, like say you put it basically you put it on twice at the same time. We don't want you to do that. If you say that you usually put on at 2 in the afternoon and you don't remember that, you forget and you remember about 4 o'clock, put it on then. As long as you're not doubling up. Some contradictions, some things that may happen with this is, or that may affect it, is a systemic fungal infection, cerebral malaria, a serious infection. Now, this doesn't occur to you, but there is some safety during pregnancy because it's category C, which means that they're not really sure, they haven't found any side effects yet that may be caused during pregnancy. There's also safety during lactation, and children under 6 years old, it's just not established yet, but they're still working on that. Some other contradictions can be kidney dysfunction and glaucoma. Some side effects that you may want to know about is it may cause insomnia, it may cause a dry mouth, so I would recommend carrying around some hard candies, sugar-free candies, gum, drink lots of water, have good oral hygiene. It could cause heartburn, nervousness, abdominal distension, excessive sweating or perspiration, acne, mood swings. It could increase your appetite. It could cause facial flushing, delayed wound healing, increased susceptibility to infection, diarrhea, and constipation. Now, we also have to warn you about adverse side effects, and those ones are less likely to occur, but they do happen, and those ones can be life-threatening. So some adverse side effects it has for the central nervous system is euphoria, headaches, insomnia, confusion, psychosis. For cardiovascular, it could cause chronic heart failure, edema. For your GI system, it could cause nausea, vomiting, peptic ulcers, and musculoskeletal. It could cause muscle weakness, delayed wound healing, muscle wasting, osteoporosis, aseptic necrosis of bone, spontaneous fractures. For your endocrine, it could cause Cushingoid features, growth suppression in children, carbohydrate intolerance, and hypoglycemia. And for special senses like vision and stuff, it could cause cataracts. And it could also cause hypokalemia. And for your skin, it could cause burning, itching, and hypopigmentation. And that's really all that we believe that you should know. Do you have any questions?
Nope, I was just going to ask the side effects, but I think you covered them.
Okay. Well, here's a handout that explains everything that I just read to you. If you think of any other questions that you have after you leave here today, feel free to give us a call. But I also want to warn you that if your cirrhosis doesn't get better or it seems to get worse, if it just persists and seems to get worse, please call us ASAP. Don't, even if you feel like you're just bothering us, don't think that. Just call us. Because we would much rather take care of it than wait for it to get even worse to take care of it.
Okay.
All right. Well, thanks for your time. I hope you have a good day.
You too.